These days, there are so many people suffering from atopic dermatitis, allergic rhinitis, and asthma. But the thing is, it doesn't just end there. In one drama, I saw a child with type 1 diabetes living a hellish life in pain. The child swings between hypoglycemia and hyperglycemia, and the mother at home can't even manage daily life. You could really see how much the mother was suffering. But do you know what caused that child's condition? It's an autoimmune disease, atopy. In the past, what caused type 1 diabetes? It used to be caused by things like nutritional deficiencies, infections, or for example, being exposed to cold drafts. Do we still see those causes now? But then why are tens of thousands of children suffering from type 1 diabetes? It's because of autoimmune diseases. And then what's really ridiculous is what the doctor says. The doctor tells the mother, and she believes it, that this is like a car accident. That there's no cause, and it just happens suddenly. Does that make any sense in this world? Seriously, that person, did they really become a researcher? Are they really that clueless? Are they saying the immune system suddenly attacks the pancreas, and that's how you get type 1 diabetes? And then with autoimmune diseases again? They probably worked hard to manage their atopic dermatitis while visiting the rheumatology clinic. Does that really count as care, in their opinion? Suppressing the immune system? By constantly suppressing the immune system so it can't expel things, and then at some point, when the sympathetic nervous system becomes overactive, it turns into a rheumatic condition. Like, for example, lupus, right? That's why it ends up attacking the pancreas directly. This lupus category you see, if it attacks the pancreas within just a few days or even a few hours, it can become a critical illness. If it attacks the kidneys, you have to start dialysis right away. So, were there really no warning signs? There aren't any. Is it really like you're just going about your day and suddenly, out of nowhere, it's like getting hit by a car in an accident? There's no such thing in this world. It's just that the earlier part was cut out. They just keep suppressing the immune system continuously. No, I did exactly what the hospital told me to do. But why don't you ever think about it? Why isn't this getting better? Why is it getting worse? Why is this getting worse? Why do I have to take medicine for the rest of my life? Why is it getting worse and worse? Why don't people think about these things? Why don't they ask these kinds of questions? So what frustrated me the most when I watched that was that one of the biggest victims is the mother. There are mothers who are suffering because their child has developed type 1 diabetes, and you see these mothers in the program, and they are in so much pain. But you know what's surprising? They are both victims and perpetrators. Who was it that gave this child those foods, provided the causes of atopy, and even took the child by the hand to get immunosuppressant injections? It was the mother, wasn't it? Then the mother says, well, I didn't know. Does not knowing make it okay? Is it murder by willful negligence? No. Because of that ignorance, because of that lack of knowledge, that child will suffer for their entire life, and you will also suffer like that. Are you okay with that? Is it really okay just because you didn't know and simply did what someone told you to do? The consequences are borne entirely by your child and by you. Haven't you ever thought about that? Why not? Why is it that a child with severe dermatitis, a child who sneezes and has a runny nose, whose immunity was suppressed, gets a little better and then relapses, gets a little better and then relapses again, and then with the sympathetic nervous system becoming overactive ends up attacking their own organs? Is there no cause? Is there anything in this world that happens without a cause? You just don't know, right? So if you don't know, what should you do? You have to try to find out. I always say this, don't I? I always talk about the old lady who used to put talismans on and got better. That old lady who used to put talismans on in the past. Her grandson was sick, so the old lady put a talisman on him. It didn't do him any harm. But look at mothers these days. That ignorant love. They grab their child's hand and go and they keep using those harsh immunosuppressants, increasing the dosage, and even end up using chemotherapy drugs, don't they? Didn't you know? Is it okay to just not know? Me too? It all started because my child had such severe atopic dermatitis. It was strange. Why does this happen? Why do they say to take this and apply it? Why do we have to use those kinds of drugs? That's why I started studying. Aren't we healthy now? Even this time, I saw it. Truly terrible, really awful atopic dermatitis, but it's not even atopic anymore. They came in with this kind of skin disease, but when I looked, they just talked as if they were victims of an accident. That's not the case. You have to find and eliminate the cause. If you leave the cause and only fight the symptoms, it's a battle you can't win. Study. Why? Why do you have to study? The only one who suffers the consequences is you. It's your family. It's not someone else, not the person who prescribed or did those things. The rheumatology department probably did their best to treat you. So when your pancreas was attacked, they probably sent you to the endocrinology department. They are certainly not the victims at all. You are the victim. You, the ones who are suffering, are the ones who need to study. Is that not okay? Then go ask someone who is good at this, someone who can clearly explain the cause. If they say, I don't know the cause, but let's try treating it, does that kind of thing exist in this world? Now, things like this are happening to 50% of the entire population. Even so, are you still not going to study? Even so, are you just going to close your eyes and pretend nothing's wrong? You can either study it yourself or leave it to an expert. I'll wrap things up here. Goodbye.